This is Dr. Cyrus Sebastian, and this is my second video from the Couch series. I'm a consultant psychiatrist, and I've made a number of video clips in response to the current coronavirus crisis. In the first video, I talked about some general measures that I think we should all implement in terms of our well-being and our mental health. Today I'm just going to focus on those with mental health issues. The current coronavirus crisis may have acted as a trigger, and it may have exacerbated psychiatric conditions in those who already have had a diagnosis, for example, depression or anxiety disorders. And the first point I need to mention is that you need to get specialist support sooner than later. It's very difficult to talk generically about mental health issues, given that we have a variety of psychiatric conditions: depression, anxiety, psychosis, bipolar mania that could be affected because of coronavirus. So get advice early from a specialist. And this can be done by it doesn't have to be done face to face. It can be done by FaceTime, it can be done by Skype, remotely, by telephone. And that way you keep yourself safe as well, and you remain in lockdown. And what I've been doing with my patients is that I've been contacting them to find out how they're coping, and to find out whether their treatment plan needs to be reviewed given the current lockdown we have in the UK. For example, their medication needs to be optimized, or they may need to be offered a therapy online, virtually, which can be as effective as offering this face-to-face. Now, all psychiatric patients need to have a risk assessment done, and that feeds into a risk plan. So a risk assessment would determine how risky they are in terms of suicide and self-harm. And some patients may have become more suicidal, and some may actually be actively planning something because they're so worried about the short-term and long-term consequences of coronavirus. One of them would be unemployment. So it's important to write up a risk assessment, and a risk plan would include a contingency plan in case things get worse. And possible options if they do become suicidal is to contact their care coordinator, their specialist, their psychiatrist, and also they can contact the local NHS crisis services, as well as the Samaritans.